Greetings, everyone. I'm here to talk about the benefits of breastfeeding. Breastfeeding is an essential part of your baby's health, and you, as a mother, will also benefit from breastfeeding your baby. Breastfeeding may not be suitable for everyone, but it is suitable for every baby. But it is irreproachably as being the right choice for every baby. As the excitement of the newborn comes in and the joys of motherhood sets in, there are many decisions that, as a mother, you will have to take. And one of the most vital decisions will be bottle fed or breastfed. As you now have your bundle of joy at home, there are three needs that need to be met for a baby: security, warmth, and feeding. In feeding, you will ask your question about bottle fed or breastfed. But here I will point out the benefits of breastfeeding for your baby and for yourself. Iris Marion Young once said that breasts are scandal because they shatter the border between motherhood and sexuality. This is true to the point that the bond of a baby does not only happen in the womb, but it also is nurturing your baby when it latches to your breast. As a mother of two, I've learned about the benefits of breastfeeding in my maternity ward. The best thing you can do for your baby would be breastfeeding. As I told you before, from my maternity ward, I learned about breastfeeding and the essential things that comes with breastfeeding. When touching my baby, this creates a bond that cannot be transformed and transferred from a bottle. Many mothers have testified that they made a lasting bond while they were breastfeeding their babies. Creating this bond also relieved mothers from postpartum depression, which is a lack of hormone that happens after pregnancy. Women who breastfed their babies did say that they felt better after breastfeeding for a few months. OBGYNs has also related the healing of the uterus that occurred when mothers breastfed. The healing occurred much faster. The American Pediatrics Association said that breastfeeding helps mothers reduce calories, lose the pregnancy weight faster, and relaxes because it releases the hormone called oxytocin, which helps the uterus return to its pre-pregnancy size. It also reduces uterine bleeding and often occurs at birth. Breastfeeding also reduces the risk of breast cancer, ovarian cancer. It lowers the risk of osteoporosis and gives the mothers the benefit of breastfeeding can also reduce fatigue because let's think of it. You don't have to wash bottles, you don't have to make sure that you have enough bottles if you go to work, and you don't have to run out and buy formula, which can be very expensive. This saves you time and money and good time with your baby. The first few days, the breast milk is very yellowish and a little scant, and the flow is not as thorough. But this is called the colostrum, and it's referred to as liquid gold. This supports the baby's nutritional needs. The colostrum will help the baby's digestive system and prepare the breast milk to fit your baby's digestion. The breast milk specifically formulated for your baby's needs. Every baby you will have, your breast milk will be formulated specifically to your newborn. Babies that are breastfed have a lower risk of asthma, ear infections, and also are less susceptible of being targeted for disorders and viruses. Research has shown that babies who are breastfed are less likely to be sick or have digestive problems from the mother's breast milk. Despite the benefits of breastfeeding towards mother and child, breastfeeding has also proven to be much more economical and less strenuous on the mother and infant. In the US alone, 77% of mothers initiate nursing at birth. 47% say that their babies has never given them significant illnesses. It has been proven that science can never reproduce the composition of breast milk. Although formula has shown to be as beneficial as breast milk, there are many antibodies in the breast milk that can never be reproduced by scientists, 450 to be exact. After several surveys, they have noticed that babies were that were breastfed had less colic than babies that were bottle fed. The USDA Food and Drug Administration and the American Pediatrics Association believe that children under the age of 2 are less sick and were less often hospitalized over bottle-fed babies. Overall, they have found that more bottle-fed babies have died from sudden infant death. Statistics also show that bottle-fed babies are 14 times more likely to be hospitalized than breastfed babies. The protein from the breast milk is high in amino acid, which is essential for the development of the brain and the eyes. Protein in the milk is mostly whey, which is easier to digest because it contains enzymes that breaks down the fat in the breast milk. The fat in the breast milk provide omega-3 fatty acids that are important in the stored fat content of the milk. It is amazing how the mother produces hormones and enzymes that helps the baby grow and develop intellectually. Infants who were breastfed for at least 9 months grew up to be significantly more intelligent. In conclusion, we can say that breastfed babies are more likely to be healthier and intellectually more intelligent than bottle-fed babies. Breastfeeding implemented early on is more beneficial for both mother and infant and decreases the chance of health issues and diseases such as juvenile diabetes, asthma, heart disease, multiple sclerosis, and allergies. The benefits of breastfeeding are endless, both for mother and child. Breastfeeding can play a vital role in the prevention of digestive diseases such as ulcers and colitis. Breastfeeding is definitely the way to go for your child. And if ever you have a newborn, breastfeeding is the way to go. Thank you.